Hi everyone, this is Neil from singlebestanswer.com. If you're a medical student and you're serious about your revision, then head over to singlebestanswer.com and check out this resource. We're going to go through some strategies to answer a single best answer question, otherwise known as best of 5. And this is singlebestanswer.com. We're going to have a look at a rheumatology question today in revision mode. So, the first question is a 32-year-old man with intermittent knee swelling. He doesn't have any pain and he enjoys running. He has mild scalp psoriasis controlled with medicated shampoo, and examination demonstrates a good range of active movement in the left knee. There is also minimal joint effusion, but there's no instability of the knee. So immediately I'm thinking he has knee swelling, which is based on his history and examination. Knee swelling is not normal, and normally anybody with a normally functioning knee will have only 3 drops of synovial fluid that are not detectable clinically. He has intermittent swelling, and my first thoughts are he has psoriasis. It may be a form of psoriatic arthritis, and to make this connection you do need to know that psoriasis and arthritis are linked, and not only that, you can experience different types of arthritis in terms of the pattern of presentation, and the monoarthritis where only one joint swells is one of these patterns. So he may have a monoarthritis affecting his left knee. The investigations show a normal CRP, which is not unusual in psoriatic arthritis, and the X-ray shows a mild effusion but preserved joint space, no bony abnormality. So quite encouraging really. He seems to have mild disease with good joint space and only a mild effusion. Doesn't seem to be bothering him too much. What the question is trying to ask us is the single most appropriate treatment for this man. It gives us 5 options, which are anti-TNF. First of all, I would say that this tends to be reserved for more severe cases, and there is a significant infection risk of anti-TNF. It wouldn't be my first choice, and certainly you wouldn't choose it before methotrexate in normal circumstances. Methotrexate is the main distractor in this question, and we need to come up with reasons why we should or we shouldn't use methotrexate. We're looking for the best answer, remember. And methotrexate is used to control psoriasis and arthritis. But in this case, he has mild psoriasis and his arthritis is fairly mild as well. It's not stopping him from doing anything, and there's no joint damage. That's the key piece of information that we need to know here, is that he has no joint damage and there's no systemic inflammation either. So which takes us on to C, which is NSAIDs such as ibuprofen or naproxen. Non-steroidals do have a role in psoriatic arthritis, and in this sort of patient I would probably go for an NSAID first. Paracetamol is a simple analgesic, but has very little anti-inflammatory effect when it comes to inflammatory arthritis. He doesn't really complain of any pain, so paracetamol for me is not the best answer here. Prednisolone I would say certainly is not the best answer. We can give intra-articular steroids sometimes if the effusion is persistent, but he's got intermittent joint effusion, so I wouldn't give him any form of steroid, especially given the long-term side effects of steroid. So C is my answer. Let's see if I'm correct. Yes. Here's a full explanation and also links to references which can be found on the website. If you enjoyed that video, then there'll be others coming out of a similar nature. Please check out our website, singlebestanswer.com, and I'll see you next time.